Did you know that over 1 million sexually transmitted infections are acquired every single day worldwide? Quite a shocking statistic, isn't it? Sexually transmitted infections, or STIs, are a major global health concern, affecting millions of people each year, regardless of age, gender, or social status. They are infections that are primarily passed from one person to another through intimate sexual contact. This includes a wide variety of infections caused by bacteria, viruses, or parasites. The reason STIs are such a critical topic is not just their prevalence, but also the silent way they often operate. Many people infected with an STI do not show symptoms and might not even know they are infected. This silent transmission can lead to widespread prevalence before the infections are even detected. STIs can be transmitted in several ways, the most common being through unprotected sexual contact. This includes oral, vaginal, and anal sex. However, some STIs can also be transmitted through non-sexual means, such as the sharing of needles, blood transfusions, and from a mother to her baby during childbirth or breastfeeding. The impact of STIs extends beyond just physical health. They can lead to severe reproductive health problems, including infertility, can increase the risk of acquiring other infections, such as HIV, and have significant social and psychological effects. Given their complex nature and the stigma that often surrounds them, discussing and understanding STIs is crucial. It's not just about recognizing how they are transmitted, but also about understanding the broader impact they have on individuals and communities. Education and open conversation are key tools in the battle against the spread of STIs. By shedding light on this topic, it becomes possible to break down the misconceptions and stigma associated with these infections. Understanding STIs is the first step towards prevention. Stay tuned to learn more about different types of STIs. And now that we've set the stage, it's time to delve deeper into the different types of STIs. First, let's talk about chlamydia. This bacterial infection is often silent, showing no symptoms. However, when symptoms do occur, they can include discomfort during urination and abnormal discharge. It's important to note that chlamydia can lead to serious health problems if left untreated, like infertility. Next up is gonorrhea, another bacterial STI. Like chlamydia, the symptoms can be silent or include painful urination and abnormal discharge. If left untreated, it can cause long-term pelvic pain and even sterility. Moving on to syphilis, a somewhat less common but still significant STI. This bacterial infection progresses in stages. Early symptoms can include a painless sore or rash, while later stages can lead to severe complications, affecting the heart, brain, and other organs. Now let's touch on herpes, a viral STI that manifests as painful sores on the mouth or genitals. While these outbreaks can be managed with medication, it's crucial to know that the virus remains in your body for life and can be passed on even when symptoms are not present. Last, but certainly not least, is HIV. This virus attacks the immune system, making it harder for the body to fight off infections and diseases. It's transmitted through certain bodily fluids like blood and sexual fluids. Over time, if untreated, HIV can progress to AIDS, a severe and potentially life-threatening condition. It's important to note that all these infections can be contracted through unprotected sex, including vaginal, anal, and oral sex. They can also be passed from mother to child during childbirth. These are just a few of the many STIs that pose a threat to our health. Up next, we will discuss the symptoms associated with these infections. Recognizing the symptoms of STIs can be challenging, as they often go unnoticed. Let's delve into this issue. Sexually transmitted infections can present a kaleidoscope of symptoms, and frustratingly, they sometimes present none at all. When symptoms do appear, they can be as mild as a rash or as severe as intense pelvic pain. However, understanding these signs is crucial for timely intervention and treatment. For many, the first noticeable symptoms are sores or bumps on the genital area, mouth, or anus. These can appear as small, painless ulcers or as painful blisters. It's important not to dismiss these changes, as they're often the first indicators of an STI. Another common symptom is unusual discharge from the penis or vagina. This discharge may differ in color, consistency, or smell from the usual. It's a sign that something is off balance, and it's wise to consult a healthcare provider for a thorough examination. Pain during urination can also signal an STI. This symptom, often described as a burning sensation, should not be ignored, as it can indicate infections like chlamydia or gonorrhea. Similarly, Pain during intercourse is another red flag that warrants attention and further investigation. Aside from these localized symptoms, STIs can also cause broader systemic effects. For example, one might experience lower abdominal pain, fever, or swollen lymph nodes. These symptoms suggest that the infection may be spreading and becoming more serious. It's particularly concerning that many STIs can be asymptomatic. Conditions like chlamydia and gonorrhea can lurk in the body without any overt signs, silently leading to complications such as infertility or increased risk of acquiring other STIs, including HIV. This stealthy nature makes regular screening and awareness exceedingly important. Remember, the absence of symptoms does not guarantee the absence of an infection. Regular checkups and honest conversations with partners about health are essential steps in protecting oneself and others. Early detection is key in managing STIs. Now let's turn our attention to prevention. Ever heard the saying, "Prevention is better than cure"? It couldn't be more true when it comes to STIs. Let's dive into the various ways you can safeguard yourself and others from these infections. First and foremost, practicing safe sex is key. This means using condoms or dental dams every time you have intercourse. It's not just about preventing pregnancy, but also about shielding yourself from STIs. Next, consider getting vaccinated. Yes, there are vaccines available against certain STIs like human papillomavirus and hepatitis B. These vaccines can provide you with a protective shield against these infections. Moving on, regular screenings are important. Even if you feel perfectly healthy, it's essential to get tested for STIs. Some of these infections might not show symptoms immediately, but they can still cause harm and spread to others. Then we have the avoidance of risky behaviors. This includes limiting your number of sexual partners, not sharing needles if you use drugs, and avoiding intercourse if you or your partner has an outbreak of an STI. But it doesn't stop there. Education plays a vital role in prevention as well. Understanding the risks and consequences of STIs can help you make informed decisions about your sexual health. It's not just about memorizing facts, but about knowing how to apply that knowledge in real-life situations. Open communication, too, is a powerful tool. Talk to your partner about STIs. Discuss your sexual histories, your concerns, and your precautions. It might feel awkward, but it's a conversation that can save you a lot of stress and health complications in the future. Remember, preventing STIs isn't just about protecting yourself. It's about protecting your partner, your future partners, and your community. We all have a part to play in this. So arm yourself with knowledge and take the necessary precautions. Make conscious choices about your sexual health, because at the end of the day, prevention truly is better than cure. Preventing STIs is a shared responsibility. It starts with you, and it starts with awareness. As we draw to a close, let's summarize what we've learned about STIs and their prevention. Sexually transmitted infections, or STIs, are a significant public health issue that affects millions globally. These infections can be caused by bacteria, viruses, or parasites transmitted through sexual contact. Understanding the different types of STIs is crucial. We've discussed common ones like chlamydia, gonorrhea, and syphilis, as well as viral infections such as herpes and HIV. Each STI presents with its own set of symptoms. Some common signs include unusual discharge, sores or bumps, painful urination, and irregular menstrual bleeding. However, it's vital to note that many STIs might not show symptoms initially, which is why they often go unnoticed and untreated, leading to severe health complications. This brings us to the cornerstone of our discussion: prevention. The most effective way to prevent STIs is through safe sexual practices. This includes using condoms correctly and consistently, limiting the number of sexual partners, and engaging in open conversations about sexual health with partners. Regular screenings and vaccinations, like those available for hepatitis B and HPV, are also powerful tools in the fight against STIs. The importance of being proactive about sexual health cannot be overstated. If there's any concern or symptoms, consulting with a healthcare professional is critical. They can provide the necessary testing, treatment, and guidance. Remember, treating an STI goes beyond personal health. It's about protecting others in the community as well. In conclusion, taking sexual health seriously and being informed about STIs and their prevention can lead to healthier lives and relationships. It's about making informed choices and taking responsible actions to safeguard not just individual health, but also the well-being of the community. Remember, knowledge is power. Stay informed, stay safe, and take care of your sexual health.